Hello everyone. This is one video out of a series of videos that talks about various kinds of birth control methods. It's important to realize that this is basic information. It's really important when you decide that you want to go on birth control that you get an appointment with your healthcare provider. You talk about your medical history because sometimes there are things that are contraindicated in using various kinds of birth control, and that you have that more in-depth conversation about what is going to be best for you. So just realize that this is just basic information about various kinds of birth control, and this is just one of them of a series. I hope you enjoy them, and again, if you have any questions at the end, don't hesitate to email me. Thank you. Hello everyone, Lori from Women's Health on the Go. This video in my series is basically about combination birth control options. I kind of decided to put 3 of them into one video because basically they're all the same. It just depends on how they are delivered. So these are combination hormones, meaning they have estrogen and progesterone in them. And they would include birth control pills, vaginal ring, and the patch. So let's start off with the birth control pill. The birth control pill is something that you have to remember to take every day at the same time. What that time is, I don't care. 9 o'clock in the morning, 11 o'clock at night, 2 o'clock in the morning, whatever time you feel like you will remember to take the pill. Typically, I tell people, like, if let's suppose you pick 9 o'clock in the morning, that you go anywhere from 8 to 10 in the morning and trying to get it as close to 9 o'clock. If you think that you can remember to take a pill every day, then this is a great method. If not, then it's not a good method for you. Because if you don't take it every day at the same time, you're going to get irregular spotting, and if you're trying to prevent pregnancy, it's not going to happen. You're going to have a risk of getting pregnant doing that way. So that is one of the combination methods. Another one is the vaginal ring. Vaginal ring is typically, I tell people, it's like a thick hairband kind of size. You do have to feel comfortable putting something in the vagina and then actually going in and pulling it out. It is good for about 3 weeks. You take it out for 1 week and you get your period during that week, and then you repeat the process. Most people don't feel it. I usually compare it to people who use tampons. If you use a tampon, do you feel it? If you don't feel it, you know it's in the right place. When you do feel your tampon, you know it's not in the right place. It's the same kind of concept with the vaginal ring. It's very easy to put in. It typically, you just got to push it up there and it just opens up and goes exactly where it's supposed to. Most people will not feel it when you're having sex, and your partner will not feel it, but sometimes they do. I tell these patients that you can actually take the vaginal ring out during sexual relations. It does have to go in after 2 hours, so those people who are having sex for more than 2 hours, kudos to you, but you need to put the vaginal ring back in if you want to prevent pregnancy. So that is the vaginal ring. And then the third is the patch. The patch I really don't talk about much with my patients anymore, and the reason being is that there has been a lot of reports coming out that because of the type of progesterone, which is a newer form of progesterone, there has been a higher incidence of people who are having blood clot, strokes, and cardiac events. So when we look at all combination birth control, there is a risk of a blood clot, stroke, or cardiac event. I always do this with my patients. I've never in my career have had any patients have that happen to them. I know a lot of other providers and they have not had it happen to them. Those kind of effects were more prevalent when birth control first came out, when the dosage was like 50 micrograms, which was a higher dose. And now we're dealing with birth control, combination birth control options that are as low as 10 and 15 micrograms. So it is a huge difference. So those kind of side effects typically don't happen, but there has been a higher incidence with the patch. I am sure, I wouldn't be surprised if the vaginal ring is to follow, because that is a newer form of progesterone as well. So I typically, for the most part, don't talk about the patch with people. If you are interested in the patch, it is a patch that you have to change every week for 3 weeks. Then you have a week free where you get your period, and then you start the process over again. The patch can be put on your arm, on your buttocks, or on your stomach. It's not to be put anywhere near your breasts for obvious reasons. It's got estrogen, and we just don't want that in that area. Sorry. So that's it with the patch. Again, you know, most people, if people have been on the patch and they want to continue the patch, and I do talk about these higher incidences, and if they still want to do it, I prescribe it for them. Or if somebody really wants the patch and I talk to them about it and I inform them about the higher risks and they still want it, I will prescribe it. Absolutely. It's just something that I typically don't really offer that much or talk about too much, just because of those higher incidences and because I don't want anything happening to my patients. One thing is, when you're doing combination birth control, one thing that really can increase your risk of those things is smoking. So for those of you who smoke, we all know that it's not good for you. And if you want to go on birth control, I always tell the people, listen, I know that quitting smoking is very, very hard to do, and it's a very individual thing. But sometimes I say, if you want birth control, it's kind of like nudges you to, you know, quit on that part. So that is combination birth control in a nutshell. Some of the common side effects that people have with these kind of birth control, typically sometimes in the first 3 months when you're taking it, you can have some irregular spotting and some breast tenderness. Your body's trying to adjust. It's like, hey, what is this stuff that you're giving me? So it's kind of trying to adjust to those things, and typically it goes away. I usually start people, especially on birth control pills, on the lowest dose possible, so that if you continue to have those kind of symptoms after the 3 months, we can adjust your dosage. Unfortunately, with the ring and the patch, there's only one of them, each of them, so you can't really go anywhere with them. But those are kind of common side effects that you can have in the first couple of months. Some danger signs when you're taking it: if you start having really severe headaches, blurred vision, chest pain, leg pain, or swelling, I tell people to stop the birth control right away, either to call or go to the emergency room. Again, I have not had that happen to any of my patients, but it is something that is important to know. So again, combination birth control in a nutshell. I hope this was helpful for you. If you have any questions about any of them, please do not hesitate to email me. I'd be more than happy to answer your questions. And thank you so much for watching my video. And remember, women's health matters. We are wonderful and powerful, and we matter, and our health matters. Thank you, and have a great day.